Hi dear students, welcome to my channel. Today I will discuss how to study NEET MDS in 1 month using a SMART protocol. So it is only 1 month left. Okay, hope you have all studying very well for the exam. And the tentative date is announced. So according to National Board of Examinations in Medical Sciences, the tentative exam date will be 2nd May 2026. So here is the NEET MDS pattern, that is mode of examination is online or computer based. Then English is the medium of examination, 3-hour duration. So for part A it is 75 minutes and part B it is 105 minutes. Then it is objective type, 240 questions in total. So for part A it's 100 questions and part B 140 questions. So rarely 1.33 minutes for each question. Okay. And then 2 parts of question paper. Number of topics for each subject is 14 and 15 and 25% negative marking for incorrect answers. And this is the NEET MDS marking scheme. For correct response it is +4, incorrect response it is -1, and for unanswered it is 0. So if you are unsure about the answer, then please skip the question. Okay. And this is the NEET MDS question paper 2025 with some solutions. It is memory based. You can go through this. So this is the NEET MDS 2026 syllabus. Here it aligns with the BDS curriculum prescribed by Dental Council of India. And it is divided in 2 parts. Part A consists of 100 questions, general anatomy, physiology, biochemistry, dental anatomy, and oral histology, pathology, microbiology, pharmacology, general medicine, general surgery. In part B, it is 140 questions, dental materials, oral pathology, oral medicine and radiology, periodontology, oral and maxillofacial surgery, prosthodontics, conservative dentistry and endodontics, orthodontics, public health dentistry, pedodontics and preventive dentistry. And it is a 1 month SMART strategic protocol, rapid revision and MCQ strategy to maximize the rank in the final 30 days. So let's go through it. So which are the core preparation principles? Here focus on various previous year question papers. It's very important. Okay, previous year questions are very important. So repeated questions may be asked. And use rapid revision notes instead of full textbooks. Solve as many MCQs you can possible, that is 200 to 300 MCQs daily, weekly grand mock test, and maintain a mistake notebook. Okay. So in week 1, focus on non-clinical subjects. So subjects are general anatomy, embryology. So you can mix the subjects. In morning one subject, in evening another subject. Then you can't be bored. Okay. So subjects which you cover in week 1 is non-clinical subjects such as general anatomy, embryology, physiology, biochemistry, pharmacology, dental anatomy, dental histology, general pathology and microbiology, then general surgery, general medicine, then dental materials. So target of 1500 to 2000 MCQs in a week. Okay. In week 2, it is clinical subjects, oral pathology, oral medicine and radiology, prosthodontics, periodontics and public health dentistry, conservative dentistry and endodontics, orthodontics, pedodontics and oral surgery. So focus on classifications, lesions, radiographic features. In week 3 and 4, final rapid revision. Revise all the subjects using short notes. No new topics. It is very important. Okay, no new topics in week 3 and 4. Only revision. So revise is the key to success. So revise. So revision, it is main key for success. Okay, how much you can revise, it will lead to grand success. So 150 plus MCQs daily, and analyze mistakes and make a mistake notebook. Daily 2 mock tests to be done. Take 3 to 4 grand tests. Then the daily study template. In morning, you can spend 3 hours for rapid revision. Then afternoon, it is 3 hours for MCQs. Then evening, 2 hours for second subject revision. Night, 1 hour for going through the mistake notebook. So total of 8 to 9 hours per day. Extremely high yield topics for oral pathology, cysts, tumors, precancerous lesions like that. Then pharmacology, antibiotics, LA, NSIDs. Then dental materials, gypsum, amalgam, composites. Then oral medicine, white lesions and vesicular bullous diseases. Final rank booster tips. So revise daily in the topics, syndromes, classifications, tumor markers, nerve supply, radiographic features. Here the MCQs plus past year questions and revision will give you high rank. Okay. So here is a smart strategy for NEET MDS. It is efficient preparation strategy for each subject to maximize score. So you can understand the concept, then solve past year questions, solve as many MCQs as possible, and then revision. Okay, focus on repeated topics and high yield areas. It's very, very important. And maintain short revision notes also. So for oral pathology, focus on cyst and tumors, syndromes, histopathologic features. So use comparison tables for studying lesions. Then oral medicine and radiology, focus on white and red lesions, vesicular bullous diseases, radiolucent and radio-opaque lesions. So study the lesions using flowcharts. Then for prosthodontics, focus on complete denture steps, surveyor parts, articulators, impression techniques. So use diagrams and instrument identification. And I am a prosthodontist and I have uploaded as many topics, and you can watch that videos, and also upload as many MCQs related to subject prosthodontics and other dental topics. So you can watch that videos also. And in periodontics, focus on periodontal indices, flap surgeries, bone defects, microbiology. Prepare index summary sheets. Conservative dentistry and endodontics, focus on GV Black classification, endodontic instruments, irrigants, and medicaments. Create flashcards for instruments. Then orthodontics, focus on malocclusion classification, cephalometric landmarks, functional appliances. Memorize diagrams and landmark charts. Then oral surgery, focus on impacted tooth classifications, nerve supply, salivary gland disorders, very important. Then fractures, complications, make summary list. And pharmacology is the most volatile subject. Okay, and also I think it is the most tougher subject for you all. Okay, so focus on important topics such as antibiotics, LA, NSIDs, emergency drugs. So study the pharmacology using drug comparison tables. It's very, very easy to remember the drugs. Okay. And in general pathology, focus on cell injury, inflammation, neoplasia, and tumor markers. So revise key mechanisms and markers. And then dental materials, focus on gypsum products, impression materials, amalgam composites. So make property and composition charts. And final smart study tip is reduce each subject to 2 to 3 pages of revision notes. Revise frequently and solve as much MCQs as possible daily. Okay, and consistency and revision giving you high rank. And finally, 7 smart work techniques for NEET MDS. That is 7 main tips. Okay, first one is the active recall. Second one is the spaced repetition. Third one is past year questions mapping. Fourth one is 80-20 rule. Then mistake notebook. Sixth one is interleaving method. And seventh one is Feynman technique. So these are the 7 smart work techniques for NEET MDS. So let's discuss one by one. First one is the active recall. It is topper's #1 technique. Okay. Here, instead of rereading notes, force your brain to remember. How to do it? Close your book, and recall the topic aloud and write everything you remember and then check your notes. So for example, after studying some tumors, try listing them without looking. It improves long-term memory. Okay, so it's very important, that is active recall. Then next one is the spaced repetition. Here the revision should happen at increasing intervals. So what is the example? For in day 1, study one topic. In day 3, first revision to be done. In day 7, second revision to be done. And day 15, third revision. And this technique which prevents forgetting the things. Okay. Next is the past year questions mapping. Most questions repeat in some form. So solve previous year's questions, 20 to 25 years questions. Mark repeated topics. It's very important. Okay. And highlight them in your notes. So example of these repeated areas are cyst, oral lesions, pharmacology, drugs and dental materials. 80 by 20 rule. What is it? Based on Pareto principle, only 20% of topics which will give 80% of question. What does it mean? Focus on various classifications or syndromes or drug of choice, tumor markers and radiographic features. It will give 80% of questions. Okay. So this is 80-20 rule. Then I have already said mistake notebook. Toppers keep a separate notebook. Write wrong MCQs or confusing concepts or tricky facts and revise this notebook every 3 days. And this prevents repeating mistakes. What is interleaving method? Instead of studying one subject for many hours, mix subjects. For example, for morning, oral pathology, afternoon, pharmacology, evening, prostatics. Then this improves the concept linking and retention also. And finally, Feynman technique. If you can teach a concept simply, you can understand it. So steps: study a topic, explain it as if teaching a beginner, identify the gaps, review again. So explain one topic in simple terms. And these are the various tips. So toppers daily smart routine: in morning concept revision, afternoon MCQs, evening weak topics, and night mistake notebook. So total of 7 to 9 focused hours. Okay. And what is the golden formula for cracking NEET MDS? Concepts to be clear, past year question papers, MCQs and revision. And this is all for now today. And all the very best, dear NEET aspirants. And I hope you have all studying very well. In the coming sessions, we will discuss various important MCQs to be asked for your exams. So, see you soon and stay tuned to my channel. And subscribe for more videos. And thanks for watching. Bye for now.